Bismillah ar-Rahman ar-Rahim. Welcome everybody to my presentation about impact of chronic gut chewing on carotid tubular flow velocities and indices in Yemeni volunteers. My name is Mohsen Amer and I'm PhD candidate in Medical Diagnostic Ultrasound, Sudan University of Science and Technology. And this presentation represents the study one as a part of my PhD project. Firstly, I would like to thank my supervisor, Professor Dr. Elsafi Ahmed Abdalla, Professor and Consultant of Medical Diagnostic Ultrasound, who gave me his encouragement and guidance. My presentation actually covers the entire section of this study, from introduction to literature review, research methods, result discussion, and finally with the conclusion and recommendations. Khat is an evergreen shrub, and in Yemen it's considered as a major deep-rooted socio-cultural phenomenon cultivated in many lands and even in mountain. And in this photo gallery, I would like to demonstrate these facts for non-Yemenis viewer. Here we have amazing mountain terraces, but unfortunately, in some Yemeni village, these terraces are covering with no any cultivation except Khat, like this. And this is a Yemeni boy holds the Khat crops, and in the background of this view we have a wide land of Khat cultivation, unfortunately. And the last one is the close shot for the Khat shrubs in Wide Valley Farm in Yemen. Let's move to introduction to continue talking about this plant and the problems statement of this study with the study objectives also. Earlier, the clinical observation concluded that Khat had amphetamine-like properties, and the subsequent chemical analysis suggested that the fresh Khat leaves contain cathine and cathinone. And in the several studies, published studies, the researcher concluded that chewing Khat evidently leads to significant rise of blood pressure in population level and established risk factor for cardiovascular diseases. And a researcher from Somalia with other Sudanese concluded that the immediate effect of Khat chewing on Doppler common carotid arteries hemodynamics were increased flow velocities and decreased Doppler indices. Regarding the instruments and technique used in this study, Doppler ultrasonography is non-invasive and appropriate technique to measure flow volume, velocity, and Doppler indices that are common parameters characterizing the vascular resistance and become important parameters in studying the effect of many diseases on vascularity in different organs. Since the Khat is considered as a major deep-rooted habit in Yemen, with high prevalence of Khat chewing for the entire population reaching 67.9%, and to the best of our knowledge, there were no published studies about chronic Khat chewing effect on carotid blood hemodynamics of the Yemeni population. And the only single study that performed on the Doppler carotid in Khat chewers was among other population, as well as It was focused on the immediate effect of gut chewing. Furthermore, the study participants were also smokers. That means the presence of the confound variable. Therefore, the rationale of this study jumps to try answering these questions. Is there any changes in carotid blood hemodynamics of Yemeni population related to chronic gut chewing? And is there any consistency in the relationship between cardiovascular disorders in Yemeni population and chronic gut chewing? Therefore, the overall study objective was to assess carotid blood flow in Yemeni's gut chewers using Doppler ultrasound in order to estimate chronic gut chewing effects on cardiovascular system. And this was accomplished by measuring carotid blood flow in Yemeni population, by differentiating between carotid blood flow in Yemeni's gut chewers as compared to non-gut chewers, by assessing the changes in carotid blood hemodynamics in Yemeni's population as association with the chronic gut chewing, finally by estimating the extent of carotid hemodynamic changes in Yemeni population according to chronic gut chewing period in years. Here I'm going to literature review. Firstly, by reviewing the PhD thesis in Khartoum University, in which Yahya Nuaimi 2015 showed progressive increase in heart rate and blood pressure that occur rapidly in the first hour of the gut chewing period, reaching its peak in second and third hour of gut chewing and regressed back to their baseline in the fourth and fifth hour of the post gut chewing period. And in this study, the researchers concluded that regular gut chewing may have sustained effects on cardiovascular system that can contribute to the elevated blood pressure at population level. Additionally, in this systemic review and meta-analysis that included 9,207 subjects, the study showed that the gut chewing could significantly affect the cardiovascular system through its effect on heart rate and blood pressure. Let's go more specific to review the literature and the effect of gut on specific results. In this doctoral thesis in Cairo University, Manal Khirbash 2004 investigated the uterine and umbilical blood flow in Yemeni pregnant gut chewers using Doppler sonography, and this study showed that there was significant increase of Doppler indices among the daily gut consumers group, which indicates reduction in uteroplacental blood flow. Finally, the study of Ibrahim and others, 2017, showed or concluded that chewing gut has significant impact on the hemodynamics of common carotid arteries, by showing significantly decreased blood resistive index and pulsatility index of common carotid arteries after chewing GAT. This study was focused on immediate effect of GAT chewing. Regarding the research methods, this study is prospective study. Was performed or had performed from August 2017 to August 2018 at the Radiology Department of University of Science and Technology Hospital in Sana'a, where the 205 participants, Yemeni participants, including 108 GAT chewers and 97 non-GAT chewers. The included subject was non-hypertensive, non-diabetic, non-cigarette smokers, non-affected with obesity and cardiopulmonary disorders. For materials and procedures, firstly, the ethical consideration was taking place, starting by obtaining a formal approval from Ethics and Scientific Committee of University of Science and Technology. Then the nature of the procedures was fully explained. Finally, the informed consent is obtained from the participants. Then a standardized questionnaire was used to obtaining demographic data of participants, including age, Gaffron rate, occupation, and body mass index, in addition to the information of their GAT chewing as daily consumption in hours and the period of chewing in years. And the procedures was performed using this Toshiba model of high-resolution ultrasound system. Scanning procedures were performed in supine position with the supported knees according to the American Institute of Ultrasound in Medicine standards. And the data collection sheets was undergone the process of revision by the specialized consultant. This was used to collect the data of the Doppler procedures. Here I'm going to results of the study. Firstly, demographic data that show the mean age was 28.3, ranging from 16 to 45 years. And regarding the Doppler velocity, the results show a decreased peak systolic velocity was observed in bilateral common carotid arteries, of the GAT chewers group compared to the use of non-GAT chewers, and was statistically significant only in the right common carotid artery and right internal carotid artery. But in the GAT chewers group, the peak systolic velocity had a significantly negative correlation with the period of chewing only in the right common carotid artery, left common carotid artery and external carotid artery. And for Doppler indices, the table 1 shows the comparison of carotid Doppler indices between guttural and non-gutturals. In this table, the comparison of these indices were significant for the whole carotid arteries except left internal carotid artery. Furthermore, in guttural group, the Doppler indices were significantly correlated with period of gut chewing. Except the right internal carotid artery. These figures show the same finding and the same result of significant correlation between Doppler indices and the period of gut chewing in years. Regarding the internal carotid flow volume, comparison between gut and non-gutturals, there were a difference with the high flow volume in the chewers as compared to the non-chewers, with the significant value just in the right internal carotid artery. Let's move to discussion, result discussion. As the gut chewing has proved to increase blood pressure and heart rate, and it's considered as a risk factor for cardiovascular complication in several studies. The decreased peak systolic velocity in carotid arteries of gutturals compared to those of non-gutturals in the current study is consistent with the proven inverse relationship between the velocity and pressure according to physics laws controlling hemodynamics, such as Bernoulli principle. Moreover, this result agrees also with that of Homa and others, who noticed that peak systolic velocity is lower in the hypertensive patient compared to healthy individuals. Since in this study, 2014 reported that the decreased peak systolic velocities were associated with a stroke, the lower peak systolic velocities among guttural in the current study may consolidate that gut can be a cause of cerebral complications besides causing cardiovascular events, as stated in these studies 2006 and 2012. Moreover, Ibrahim and others indicated that the end diastolic velocities in carotid arteries of gutturals were mostly increased, which is in the line with the current study findings. To convert the aforementioned findings, the decrease in resistive index and pulsatility index is mathematically consistent with a decrease in peak systolic velocity and increase in diastolic velocities according to the Doppler indices equation, and based on also the finding of Chow and others study. Moreover, the decrease in resistive index and pulsatility index in carotid arteries, that means leading to low blood resistance in extracranial blood vessels, agrees with the increased blood flow volume in bilateral internal carotid arteries. That is statistically significant in the right one, as stated in the result. Furthermore, this finding agree with the result of Ibrahim and others study, who revealed that cerebral perfusion may be affected and increased by gut chewing. Since the active gradient in gut cathinone is pharmacologically similar and structurally related to the amphetamine, according to the WEEP study 2011, the decrease in Doppler indices and increased cerebral perfusion are also noticed as amphetamine impact on cerebral capillary, which may interpret the correlation of amphetamine abuse to hemorrhagic stroke, according to Westova and others study in 2007. Consequently, decreased Doppler indices and increased cerebral perfusion may interpret the desirable and acutely psychostimulant effect of gut chewing, including mental alertness, increased energy, and so on. That stated in the Palent and others study 2009, in addition to other studies, and also interprets its side effects, including intracranial swelling, edema, and hemorrhage. That is stated in the Abdul Mughni and others study 2018. The correlation between gut and strokes was proven due to the effect of cathinone on central nervous system, which finally leads to platelet aggregation, according to the several studies. Although this mechanism relates to the ischemic stroke, the mechanism related to the hemorrhagic one correlated with the chronic gut chewing, to the best of our knowledge, has not been established, and no study has discussed the cause of increased hemorrhagic stroke among the gut chewers. Nevertheless, it was recommended for further study, as mentioned in Salam and others study 2009, in addition to the other study done in 2017. Additionally, a study conducted in Sana'a City, Yemen, revealed that hemorrhagic stroke are happened mostly among patients aged between 15 to 44 years, and 43.4% of the entire sample were gut chewers. However, another study conducted on Mukalla city in Yemen also revealed that the mean age of stroke among the study sample is similar to that noticed in other Middle East countries, which was within the 7th and within the 6th and 7th decade of life, with predominance of ischemic over hemorrhagic type. This controversial argument resulting from the one country can be due to regional and cultural reason. In Yemeni northern mountainous area, Khat is growing and cultivated from hundreds of years, while it is not cultivated in southern coastal areas, according to the report of the World Bank 2007, in addition to the Noman study 2012. Therefore, Khat chewing could be one of the main causes of hemorrhagic stroke in Yemen, and it may become like untreated hypertension. Accordingly, this is the first study that reveals and discussed the mechanism of hemorrhagic stroke based on significantly decreased resistance of extracranial and cranial blood flow among Khat chewers. When evaluating the Doppler parameters in carotid arteries among the Khat chewers group itself, it was revealed that the resistive index and pulsatility index and most of the peak systolic velocity also had a negatively significant correlation with the period of chewing, indicating that these Doppler parameters decrease with increasing period of chewing, which confirmed and supported the previous finding in comparison between Khat and non-Khat chewer groups. These results, with the results of the several studies, who reported that chronic Khat chewing has obvious effects on carotid cardiovascular system, may strengthen the previous suggested conclusion that Khat could be a risk factor of hemorrhagic stroke. And they may also reinforce the interpretation of why the hemorrhagic stroke mostly occur among younger population in Yemen, while it mostly occurs among the elderly in the other Middle East country, according to the many studies done in different years. Therefore, the study is important and can be a clinical guidelines for physicians in preventing or at least decreasing the complication associated with cerebrovascular perfusion resulting from the chronic Khat chewing. So, the current study concluded that chronic Khat chewing has mostly significant alteration in the blood flow velocities and Doppler indices, with decreasing in peak systolic velocity and the Doppler indices, and increasing the end diastolic velocities. In addition to increasing flow volume of the internal carotid arteries, which prove the relationship between the regular Khat chewing and stroke. Moreover, the negative correlation between carotid Doppler indices and the period of Khat chewing could help in the illustration of mechanism through which Khat chewing could be a risk factor of hemorrhagic stroke. Therefore, this study recommended that these findings should be taken as a clinical guidance or guidelines for physicians in preventing or at least decreasing the complication associated with the cerebrovascular perfusion, particularly among those with the non-cardiovascular disorders. Secondly, further studies are recommended to address and confirm this study finding using transcranial Doppler ultrasound technique that has higher temporal resolution. And here the slide of reference list. Thanks for attention. And this is a photo of my beloved son, this generation, that we hope to be aware from this a major problem in Yemen, gut chewing, regular gut chewing. Thank you so much.